I'm trapped inside this body that I don't want to be in. And around 18, I started getting these tumor-like masses on my legs. This is the lymphedema in my right leg. It disgusts me to look at my legs.
So not only is Christina morbidly obese, but she also has massive lymphedema masses on her legs. So what is lymphedema? Well, lymphedema basically is swelling of lymph fluid. Lymph fluid is kind of like swelling type fluid that we have going through our bodies. This fluid runs through our lymph channels, and if those lymph channels and lymph nodes get clogged up, then you can get backup of that fluid and it can cause excessive swelling like you're seeing with Christina. The most common cause of lymphedema in developing countries is parasites. Here in the United States, the most common cause may be obesity. So how does obesity cause lymphedema? Well, the excess weight can compress the lymph channels, preventing them from moving, and you get that backflow of fluid, and you get the masses that she has.
I can't take care of myself any longer. Zach and my mom have to take care of me. The last time I was weighed was 678. My weight is out of control.
What a tough situation, both for Christina and for her husband who's taking care of her. So she said the last time she was weighed, she was 670 pounds. How much of that weight is due to the lymphedema? Believe it or not, probably not a ton of it. Some of it definitely can be accumulating in those huge lymph masses, but not hundreds of pounds worth.
My full-time job is taking care of Christina. She tells me that she's a burden to me, but she's not a burden. She's my pride and joy.
So this is Christina's mom, who obviously is helping take care of her. This is a very difficult situation both for the patients and for the caregivers. And there can be a lot of enabling and even manipulation going one direction or the other, or even both. So let's follow a little bit more what's going on with her family dynamics, and let's see what happens when she meets Dr. Now, who, as you know, if you watch this show, never minces words. Okay, so the good news is she's 639 pounds, not 670 pounds, but that's still obviously a lot of weight for her to lose.
She's surrounded by enabler. I need to see you lose 30 pounds next month. Get you in best shape for doing the surgery. Okay.
If you watch My 600-Pound Life, you know that Dr. Now will oftentimes have the person first lose a small amount of weight to essentially prove that they're serious about having this operation. So why is that so important? Because wouldn't just having the operation cause you to lose the weight you want to lose anyway? Well, the answer is that you can actually gain the weight back even if you have a gastric bypass surgery. Even though that stomach has shrunk down into a very tiny size, the stomach can expand and the person can actually gain a lot of their weight back, if not sometimes all of their weight back. And so when you consider all of the resources that are spent to help this patient to lose weight and be healthier, we want to make sure that those resources are well spent.
If Dr. Now doesn't see a lot of weight loss, he might not give me the surgery. Hold on, I got you.
Oh wow, that is definitely really disappointing. Now, I have seen a lot of episodes of My 600-Pound Life, and it is very rare that somebody gains a lot of weight when they're put to this challenge by Dr. Now. So let's see what Dr. Now does next. Is he going to basically turn her down, or does he have something else up his sleeve?
Christina must be consuming 7,000 calories a day in order to gain 17 pounds. We need to separate Christina from her enabler, so we're going to put her in the hospital to give her a chance.
So two things let's focus on that segment. He mentioned at the end that they need to separate her from her enablers. We know that Christina is essentially bedbound. She's in a wheelchair. She can't really get up very well on her own, so she's not the one bringing her food to herself. It's her family doing that, and they are apparently feeding her 7,000 calories a day. So how much food is 7,000 calories? Well, if you look at one of their favorite meals, and they mentioned in the show a part that I didn't show here, fast food is a big thing for them. And let's think about the Big Mac, which is my favorite sandwich at McDonald's, even though I rarely eat it. One Big Mac contains about 500 calories. So in order to get 7,000 calories, you need to eat 14 Big Macs a day. Well, obviously, she's not just eating Big Macs, she's eating meals, and so a Big Mac meal with a large fry and a drink is about 1,200 calories. So that means that she would need to eat 6 Big Mac meals to make that 7,000 calories that he is estimating that she is eating. And obviously, that is a ton of food.
Christina came to hospital about a month ago. We put her on a very strict 1,000-calorie diet. On 1,000-calorie diet, she should lose 50 pounds a month.
651.6.
The enabling environment is still dead.
1,000 calories is not a lot of food. So I actually went ahead and made a meal plan for somebody who would be eating literally 1,000 calories in a day. So a typical meal plan would have 3 meals in the day, and for breakfast it would be 1 slice of toast with peanut butter and bananas. For lunch, it would be black bean and chicken soup, and for dinner, it could be a small Thai shrimp salad. So this is a massive change for somebody who is intaking normally 7,000 calories a day to drop to 1,000. It really is a sea change, and I can imagine so difficult for her. But it looks like she's not just eating 1,000 calories a day. According to Dr. Now, she's being supplemented by her family, who is unfortunately enabling her. And that's a really tough place for a family to be in. I mean, to see your child or your spouse so hungry and I'm assuming grumpy and unhappy, you know, you want to make them happy, but at the same time, making them happy by giving them food is in the end killing them. So just a tough situation for everybody involved. Crepey skin? Don't start with plastic surgery. Try these natural options first. Take a collagen supplement. Studies show that taking a daily hydrolyzed collagen supplement can increase the collagen thickness of your skin. Apply a retinol cream. Retinol, or prescription strength tretinoin, can increase the thickness of the dermis of the skin. This is the deeper layer of the skin that can get thinner with age. Apply a combination of bakuchiol and hyaluronic acid serums or creams. Bakuchiol works similarly to retinol, and hyaluronic acid is a powerful moisturizer of the skin, so it can make the skin look smoother. If you have the means, consider fractional laser treatments or Morpheus 8 treatments at a doctor's office. If you do all of these things, then you should notice the crepiness of your skin improving within just a few months. Always autojuvenate before you operate. More in my new book, Younger for Life. Go to autojuvenation.com or click the link in the caption below to get it. And if you pre-order it before it goes on sale, you will receive over $100 worth of free gifts.
At this point, only hope will be we make Christina more active. You need to be more mobile. So I'm going to schedule you for lymphedema surgery. Hopefully this will be a motivation for her to be able to be more active and lose weight.
One thing Dr. Now mentioned in another segment that we didn't show here is that Christina was always with at least 4 or 5 people. And if you look at these images, you can see there's always a bunch of people with her, and all of them apparently enabling her and kind of giving her food on the side. So getting her more mobile by taking off these huge lymphedema masses will hopefully get her more independent and have her take more control of what she's eating.
Removal of this lymphedema mass can be dangerous. These are very vascular structure. If we're not very careful and we have too much blood loss, that can be life-threatening.
These are huge masses that don't have, let's say, a stalk. Okay, if you ever watch, let's say, Dr. Pimple Popper, often you'll see her remove something that has a maybe small stalk with a large mass hanging from it. Those are much easier to remove than, let's say, lymphedema, where it really is just kind of like an outpouching of, let's say, her legs. In those situations, you need to make really long incisions. You need to cut through a lot of tissue, and that tissue is filled with fluid, and so as you're cutting through the tissue, there's fluid just leaking out all over the place. These are very, very difficult and even dangerous operations. So one thing some people ask is, what about liposuctioning that fluid? Can you liposuction this lymphedema away? And the answer is no. If you liposuction this lymphedema tissue, you can temporarily pull out some of that fluid, but the lymph channel problems will remain and that fluid will come right back.
Almost 19.
Now, when somebody who weighs over 600 pounds, you think that 20 pounds is not a huge deal. But really think about it. 20 pounds essentially is 2 gallons of milk. And can you imagine strapping a gallon of milk on each leg and walking around every day with that on? It's also possible that they remove more than that. If this was just one leg, they may have taken more off the other leg too. So I'm really hoping that this can be a new beginning for her, because 20 pounds on one or both legs, that is a lot of weight.
It's been a month since my surgery, and I'm able to do so much more now that the lymphedema has been removed. I can go up and down the ramp now without the wheelchair and just do simple exercises around the house.
Well, this makes me really happy because she is now starting to move on her own and becoming more independent, and I'm hoping that this is a big, big start for Christina.
Christina had done a great job to be able to get you prepared for your weight loss surgery. Okay?
So that is a ton of weight for her to lose, especially on her own, over 60 pounds. So her next step is surgery, and typically there are 2 types of bariatric operations. Those are operations that can help somebody lose weight. You have a gastric sleeve surgery, which is the most popular, where essentially you remove a good portion of the stomach, making it about the size of a banana. And the second operation is a gastric bypass operation. And this is where you remove the majority of the stomach, you bypass it basically, and you keep only about a golf ball sized part of the stomach left. And then you essentially bypass the first portion of the small intestine, you attach that tiny remnant of the stomach to a portion of the small intestine kind of further down, and that way the person basically absorbs less nutrients, less calories, and it helps them lose weight even faster.
Today, we're going to do her bypass surgery. You know, when we're dealing with somebody in her size, there's always a heavy abdominal wall that we have to battle with to get the instrument inside.
Back when I trained, I did assist with a number of gastric bypass operations. This operation is being performed laparoscopically, where small incisions are made into the abdomen, and then you use a fiber optic camera along with instruments that you basically use far from the abdomen to remove those portions of the stomach and then bypass it. Back when I assisted with this operation some 25 years ago, it was open, where we would literally make an incision all the way down the abdomen, go through the subcutaneous fat, open the abdomen completely up, and perform the surgery that way. Recovery is much longer that way. The risk of complications is much higher. So if this can be done laparoscopically, like Dr. Now is doing it, that's a much, much better way to do it.
I can walk so much longer. I'm moving around a lot more than what I ever was before. I love being able to do stuff on my own. Let's go again. I'm gonna push myself and try harder to keep losing more weight.
That is so great to see that she's lost over 150 pounds, but I think she is just getting started. I'm really excited to see where she's at several months later, because you can lose hundreds and hundreds of pounds after this type of an operation.
Today I'm going to Dr. Now's for a weigh-in. Over a year ago, I never expected to be where I am today.
When I saw you first, you could barely walk and you could barely breathe. I'm proud of you. You made it that far.
Thank you, Dr. Now. There's definitely a lot more to go. I want to go to college, get a good job, I want to travel.
I'm so happy for Christina that she did this for herself, and props to Dr. Now for taking her on and really working with her to get her where she needs to be healthier and happier. Now, Christina's family was definitely enabling her by giving her extra food on the side when she really didn't need it and it was hurting her. But even though they were doing that, my hope is that her family were supportive of her as she continued to get healthier and healthier, because that is not always the case. In fact, I recently reacted to an episode of My 600-Pound Life where a husband was doing the exact opposite. He was not supporting her weight loss, and he was trying to stop her from exercising and being healthier, believe it or not. Take a peek at that episode right up here, because it's going to blow your mind. And remember, eat real food, use clean skincare, and auto-juvenate before you operate.